Okay, Tim, I think we'll go ahead and start.
Great.
Thank you everyone for joining. My name is Noah. I'm Head of Business Development in Zencity. I have the honor to host here Tim Coon, the City Manager of the City of Meriden, Connecticut. In a second, he will share all about himself, the city, and the residents of the city. Just to put everything in context, Zencity is hosting many of the city managers and mayors of its network to share best practices between peers during COVID-19 challenging times. Zencity, what we do is we help city managers and mayors to better understand the residents' feedback by leveraging open data, social media sources, etc. And we're very honored to host city managers here to share more about how they work with the residents and with their city employees during these challenging times. So just to go over the agenda briefly, Tim is going to share more about himself and the city, and then go over and share some of the main challenges that the residents has been experiencing and how the residents were impacted in the past month. Also talk about the city hall side. So when we're talking about operational continuity, repurposing of different departments, and then we'll go over and go to best practices that the team will share. Obviously, we'll also open the stage for any questions and answers. Please feel free to ask them throughout the session, but we'll also leave a few minutes at the end for concentrated time. Yeah, so Tim, your stage.
Great. Thank you very much, Noah, for asking me, and thank you very much, Zencity, for putting on this webinar. A little bit about myself. Believe it or not, this is my first city manager job. Kind of jumped right into the fire, as it were. So I've been in this position for about 1 year and 3 quarters. Previously in my career, I've served 14 years as either a town councilor or a Board of Education member in another community here in Connecticut. I spent 25 years with the state of Connecticut as an administrator in a couple of different agencies in the state of Connecticut, the Office of Emergency Management and the Police Officer Standards and Training Council. And I just retired 2 years ago from a 31-year career in the Army and the Army Reserve, where I retired as a colonel and the commander. My final assignment was as the commander of the Army Reserve Element for European Command. And I just want to add one additional bit of information that I believe has assisted me significantly in dealing with this COVID-19 pandemic, and that is I'm also a combat vet, having spent mobilized to Iraq in 2006 and 2007. I'm also a former high school history teacher and English teacher, and have 2 master's degrees, one in public administration, one in strategic studies. And that's who I am in a nutshell. Meriden itself.
It's amazing. It's amazing how much you did. Like, did you do everything in parallel? Did you do the masters while you were in the Army and also teacher?
The answer to that is yes. I had a very understanding wife and 2 daughters as well. So I kept myself busy during that time frame, which frankly has prepared me, I think, well for dealing with the challenges we're currently in.
And you shared that you did you worked as a council member in the city?
Yes, I was a town councilor for about 8 years and a Board of Education member for 6 years. Broken up during I left the board and became a council member because I had to resign because I was mobilized to Iraq. So that kind of gives an idea of how I was overlapped. The parallel tracks, as you brought up, Noah. So in case Meriden itself, Meriden is located in the center of Connecticut, equidistant between Hartford and New Haven. And another perspective, or for those of you outside of the Northeast or New England area, it's almost exactly the same distance between New York and Boston. So I sit astride the division zone between either a Yankees fan or a Red Sox fan. Luckily, I'm a football fan, so I have no dog in that baseball fight. The city is about 60,000 people, with about 11% below the poverty line. Our median income is about $57,750, 64% white, 24% Hispanic, 10% African American, and 2% Asian. But one other very interesting characteristic of the city is we have a large amount of parks in the city itself. Over 2,400 acres in a city that's only 24 square miles in area. We have basically 1 acre for every 25 residents when the average is 1 acre for every 100 residents. So the city is a magnet for parks. We have 2 large parks, one of 1,800 and one of 700-800 acres, where there's a lot of hiking and offers a lot of passive recreation. And that lends itself to a lot of management issues, which we will, I'm sure we'll get into as we go forward in the webinar.
And Tim, what you shared with me before, which I think is also relevant in general for the city operations, but also during this time, is that you actually have a hospital in the city.
Yes, we are a hospital city. We have Mid-State Hospital, which is a hospital in the Hartford healthcare system. So we do have a medium-sized hospital right in the community.
I'll just mention again that if you want to ask any question throughout the presentation, you can click on the Q&A button just at the bottom of the slides. So we wanted to jump right into probably one of the most important things in the city, which are the residents. And the residents obviously play a really big key role here. Also, when we're talking about dealing with COVID-19 and communication between the city and the residents. We wrote a few points together about the kind of the main challenges that residents are experimenting. And I guess we'll jump right into the first point, which are the businesses that are impacted. So can you maybe share briefly what the business kind of map looks like in your city?
Sure. Early on, Governor Lamont, back on March 20th, closed down businesses that were non-essential. And as many of you, I'm sure, have experienced, there's a lot of variation in what is essential and what is non-essential. In general, what that has meant is that many restaurants have closed to the public, though they can still serve food that is picked up or delivered, as well as alcohol, which was a change that took place during the closure. Virtually all retail stores have been closed, and that's many of those, and the small businesses that are, that support those types of categories of businesses have been affected as well. So there is a good amount of business closure, but there's actually, frankly, a lot that is still open. Meriden has been historically a manufacturing city, and there still is a significant amount of manufacturing in the city itself on the outskirts of the city. So our manufacturing is open, but our mall is closed. Our hospital's open, but our restaurants are not. And one of the significant concerns that we have had in the city is that we're trying to revitalize the downtown, and we felt we were on the cusp of moving to really open up our downtown to get a vibrant downtown area. We made a lot of physical renovations, which have won us a lot of national and international awards. But what needed to come along are those small businesses, the restaurants and the pubs and the types of businesses that will encourage activity back downtown. So we do have residents who have lost their jobs, quite a few. We don't have exact numbers from the state because we have to wait for the month of April to come out. But as of March, our unemployment rate was 5.9% is the last data that we have from the state. So there are the nail salons, barber shops, those types of small entrepreneurial type of stores and businesses have been significantly impacted.
And Tim, we have actually 2 questions already. Sure. The first one is, How did the residents embrace the closures of such critical industries? And can you share any feedback you received?
Yes, the residents took it fairly well for the most part, and recognized, of course, this is a disadvantage that's an advantage in some respects with being so close to New York City and seeing what has been taking place in New York City. It was much easier for the residents of Meriden to recognize that this is a serious illness, that it will affect you. People will get it. People will die from it. To enact the closures of the businesses that the governor did was fairly well received. And obviously using the Zencity platform, we do take a look at what comments are being made regarding the opening or the closing of businesses. And now as we look to the last bullet, the reopening of the economy, there's most of our comments are indicating that the residents understand why this is occurring. And I think that's pretty important takeaway from the whole process of dealing with this pandemic, and that is the need to communicate why things are being done the way they are, to help people understand that measures that are being taken have reason behind them. It's not just because. Now, I'm sure many of my fellow city managers or other government officials recognize that or have put into place emergency declarations for a certain segment of the population that is antithetical to what they believe is appropriate. Again, I brought that up because there are a few comments associated with the declaration of emergency and the feeling that this is being done simply because there's an authoritarian movement. But that's been pretty well negated by communicating why these things occur. Now, Meriden has a fairly interesting governmental structure, and that is a council manager form of government, but we do have a mayor. And essentially the mayor is the public face of the city, and the city manager is for all intents and purposes, the CEO of the city. So I report to the council, but I work very closely with the mayor, and we have built a very good relationship, which is important to provide the information and communication to the public. So I think I got the first one. Was there a second question coming to?
Yeah, actually a second question driven by what you just shared about all the work your city has been doing in order to get a really vibrant city center, and a lot of effort that are maybe at risk right now because of, and this is going to the second point of social distancing, business closures, and even when business will open, will it look the same? Will people be looking to be crowded or not? So kind of interested of hearing your thoughts about this movement.
Well, and it just came to me as you posed that question, Meriden might have an advantage in some respects because when I referenced awards that we've won, it's because we created, essentially, it's a flood control plane in the very heart of the city by removing quite a lot of structures. So now it's known as the Meriden Green. So it's a 14-acre park right in the center of the city that has a stream flowing through it, et cetera, that will have businesses, and the state opened up a train station or rebuilt a train station right on the green, right in this downtown. So our concern prior to COVID-19 is that, okay, we've got the infrastructure in place. It's beautiful. People are starting to come back to the downtown area. But now we needed to be able to provide businesses. There are businesses currently, but they need to get over that hump of Meriden's a good place, fun place to come back to. So we were a couple of years out from building that vibrancy that is about to take off. There's been over $100 million in investments essentially around the green with the development of over 700 apartments sitting right on the green. So those apartments are coming online right now. So with that critical mass of people downtown, we felt that that would accelerate the restaurants and that type of business downtown. But with the COVID-19 and the social distancing components, that will probably affect everybody across the way going forward, these types of businesses, at least until we've got medically, the medical capability as a society to deal with the pandemic. We have a director of economic development. He and I have had numerous discussions of what it would look like, what the city has to look like going forward, so we don't lose the momentum that we have generated so far. So that is a concern, without a doubt. I don't think we have an answer to that, except continual communication, continual marketing, continual creativity in how to respond to what has been given to us right now.
Yeah. And a follow-up question about that from one of the listeners is that they see that across the country, it's been hard to implement social distancing in some areas in the country. So you mentioned in a second kind of that the residents, because of your proximity to New York City and the devastating situation there, maybe they're kind of more aware about it, but has it been an issue to observe social distancing? And did you get a lot of residents pushback?
Yes, there has been pushback in a couple of areas. You know, I mentioned before, we have quite a lot of parks, and when we implemented various measures to close parks, so we did get some pushback. But what we have been doing and following the guidance and actually, you know, of professionals and law enforcement and city management and so forth. The best thing to do is get compliance, communicate and gain compliance for individuals who are not following a social distancing rules. And to date, we have had no major issues. You know, a little bit of pushback, a little grumbling, you know, when we do have employees remind individuals who are not practicing social distancing that they need to, but we have not had any significant incidents associated with that. No arrests. Early on, I mentioned compliance, and early on I made it clear to our police department that we will not be issuing fines or citations for this. We want to gain compliance for a couple of reasons. That just accelerates the situation needlessly, 99 times out of 100. And the other thing is, I don't want my police officers, my department, to be exposed unnecessarily. They still need to be able to do true life safety measures, and I don't want that becoming a problem with officers who are infected.
And the fact that you have instructed not to issue fines or to try to avoid arrest as much as possible, has it been something that was officially communicated, or was more of an internal discussion? No,
it was officially communicated in our statements that no, we will be only issuing compliance. And the perfect example of that is we obtained some drones earlier this fall. We do have one of our parks is Hubbard Park, and there is a large geological feature, essentially a mini mountain, as it were, with a large cliff face on it that unfortunately people fall off on a too regular a basis. And that's in the 1,800-acre park. So we purchased the drone so that help in search and rescue in the area. And can be used by fire and police. Well, early on, I realized that the drone can also be utilized for carrying the message of social distancing. So on the weekends, when our parks have a tendency to fill up. We put the drone up in addition to the signage that is throughout our parks to maintain social distancing, we make announcements with the drone. It has a PA on it and the police officer. We have a specific script and we use that to remind people social distancing. Well, that became a big story here in Connecticut, and numbers of papers and newspapers, and TV stations, et cetera, came to talk about that. And during those articles, that's where we were specifically saying, no, we will not be issuing fines or citations. This is, we will, in the social distancing, we will be simply gaining compliance, reminding people, and thus far it has worked very well.
And how were you able to communicate? Are you issuing a newsletter? Is the mayor mostly doing most of the communication, or how did you communicate the different measures? Basically any points that is on this screen.
Early on, when I got here, I recognized that the city really needed someone to coordinate communication and build a communication strategy. So I was able to get through and had it approved last fiscal year to the hiring of a strategic communications specialist. I was lucky enough to see what a strategic communications expert can do during my time at European Command, and thought that the city could find that very useful. So we did. We hired somebody who started in December. And that person has been the coordinator for the mayor, for our public health director, for our counselors, for myself, to get our message out in as many platforms as possible. Our website, Twitter, Instagram, Facebook, through the traditional media. And she has been making sure that we coordinate our messages, coordinate video information that we put out on a regular basis several times a week. Our director of public health, Leah Crown, who has been spectacular once again, lucky to have great staff. And she puts out an update every day. I put out an update that goes to counselors so they have their talking points through their media outlets. So we try and think of as many ways as possible to get the message out. And we are, there is, as I mentioned before, 24% Hispanic or Latino. So we make sure that we conduct all these messages. Certainly when it comes from the city specifically, is also available in Spanish.
Thank you for sharing that. And I think definitely what we see, and we see it across all the cities we work with, is that, and you mentioned so many, you mentioned the traditional kind of ways, but you mentioned before that Twitter, Instagram, Facebook, because it seems like it's been such a large percentage of where residents are actually sharing their feedback. And what I'm guessing, I would love to hear your input, is that it's going to be even more so now when we're looking at social distancing and maybe even less people willing to come to council meetings. How do you kind of estimate this will go?
We are finding when we do our virtual council meetings that we are having more people actually, shall we say, physically present. I'm sure most of us have found that attendance at many of these meetings is fairly low, and we get the same people every time. But as we do our virtual meetings, we're able to see how many people are tuning in, and we're at least 4 times the average number that we normally get. And I have gotten a couple of comments from people that they really appreciate it. Some of them couldn't get out before, and now they can get their questions in as well. So in some respects, we're never going back. We've instituted teleconferencing within the city staff itself. We're using Microsoft Teams. I didn't get paid to say that. That's just what we happen to use and builds our system the best. Most of the staff have found that it's very, very useful, and we are utilizing it more and more. even when, well, we have to do it. It's one of the things I made clear to staff is that no meetings in person, do it versus Teams or versus a teleconference. But my staff are becoming very comfortable with it, as well as counselors and committee members.
I agree. I think it will be hard to go back, and we're hearing it across the board that residents are interested in participating, just not in the traditional channel, maybe because they couldn't, even they don't have a car and they can't really come, or they don't feel comfortable in showing face to face. And I think COVID-19 is going to change forever, maybe the way that residents and the city is communicating. We do have another question from the audience about the strategic communication director, asking was it in addition to any other communication stuff you already had?
No, I had IT staff who essentially ran our website, but they're technical people. They're not skilled in the crafting of message. And that's what I saw as critically important. Someone who is skilled in the crafting of a consistent message to get the point across that you're trying to get across. So I put together the job description for a strategic communication specialist and made it very clear that I'm not looking for a web designer. I want somebody who knows how to use social media, knows the metrics, knows the specifics, has some skills in it, but really has the ability to craft press releases, to craft a communications plan, which is what our strategic communication specialist is developing. She hasn't even been on the job 6 months yet. And that is her due out at the end of 6 months is the strategic communications plan. Because one of the principal things that we were identified with is that we wanted to enhance the reputation of the city of Meriden. It used to be known as the Silver City because the concentration of silver manufacturing. And in the early 20th century and throughout most of the 20th century, Meriden was a very influential artistic and cultural city known worldwide. Well, in the 80s, that business collapsed and left a hole in the psyche of Meriden that we need to reconstruct. So that is why a strategic communications specialist was identified as needed, and it's frankly, other than having a spot-on stellar director of public health, that's been the #1 capability that I have at my disposal to deal with the pandemic.
So this is also something that you're not going to go back on, having a communication specialist on your team dealing with social media and crafting messages.
Not while I'm here.
So just the last point before we'll move into internal city hall dilemmas, can you share a bit about the activity closures? And you talked about parks. We know that you also have golf course and shopping centers. Were there any specific issues or feedback around these specific topics?
Probably our biggest one was the issues around the golf course. We do have a golf course in the city as well. A municipal 18-hole golf course that's one of the best ones in the top 10 in the state of Connecticut. So it's a good course. Well, when the governor closed businesses that were non-essential, there was no indication of whether golf courses were essential or not. We, just by logic, okay, golf courses were, well, they're hard to say that they're essential. So we assumed that they were non-essential and closed it on the 24th of March, which was 4 days after the governor issued the order about essential, non-essential. We looked for clarification from the governor's office and eventually got that indicating that golf courses could be open. So we reopened it on the 27th of March. The 24th of March. March 20th is when the governor issued it. We closed and we reopened on the 24th. We looked at how things were going and found that the users of the golf course were not following social distancing norms. They were congregating in the parking lot afterwards, having a beer and a cigar, stuff, normal type of activities. After a couple of days of notification that please don't do that, and it wasn't abating, we reached the decision, well, let's close it for a little while. And our overriding concern was we would much rather have you off the golf course than in the hospital, because golfing itself, relatively low risk exposure, because you're almost naturally social distancing. At least I do when I used to play before I was wounded. My golf ball was all over the course, so I was never with anybody. So in any case, but that wasn't occurring in various places around the golf course. We didn't have our clubhouse was closed. We just had our pro shop open with carts and the parking lot. So we have closed it, but we just reopened it on Tuesday because the opening criteria that I developed with staff was met. So we reopened that, and that was probably, at least from my perspective, the most controversial decision that I made, and certainly got the most emails, calls, letters, etc. On the closure of the golf course.
And is it, so you said that that the city is a hospital city. Is it also a golf city? Why do you think it created so much, that much pushback?
I believe simply because it was really one of the few outlets that a segment of the population could take advantage of. They weren't going to go out and play sports because that was closed to begin with anyways. For some reason, they probably weren't going to be out hiking, out walking in the parks. So it was and they tended to be individuals who were also very vocal. I mean, those are my conjectures at the time. I don't have any empirical data regarding that, but many of the golfers were also members of influential organizations in the city.
And did you see the sentiment kind of changing to the better after the decision to reopen? Or did you have also concerns from other segments?
Well, there will be concerns, certainly, from the public who were concerned it was open at all. Why are they out there golfing, et cetera? That's non-essential, which goes back to the point I mentioned earlier. Well, we do have protocols in place, very specific protocols that have been vetted across the country, frankly, because our director, superintendent of the golf course was working with the U.S. Golf Federation, looking at what was being done. And we're also following the cue of New York State and New Jersey. New Jersey is opening up their golf courses this weekend. New York State, much of New York State last weekend. We were looking at experts and what other people were doing to reinforce that our opening criteria was adequate. It was protective of the health of citizens, and always every decision I made was also looking at the health of city staff. And our decisions regarding city staff, I believe that's the next slide, and I can get into it there if you want.
Go ahead.
But our city staff, I've only had, out of the 500 plus full-time staff members in the city, not inclusive of the Board of Education, we've only had one positive COVID-19 test. And that includes the police department, fire department, and all other city employees, which is less than half the rate of the surrounding population of the city. So I would say that the decisions that we made here have protected our city staff well. Now, we can hope to continue doing that, and we will continue to maintain those protocols, social distancing, hygiene, types of protocols to protect staff so that they can protect the citizens so that we can still provide city services to the community.
And I'm sure that going back to the points before, the fact that you're moving to digital, whether it's meetings, whether it's basically any interaction, and also not giving the fines, not doing this arrest, really helping keeping the social distancing measures obtainable and keeping the staff safe. And I think that when we're talking about the kind of the city hall challenges, moving from the residents going more to the organization itself, I think one of the main things that we're hearing from a lot of the cities is talking about, how do you create the budget in this time of uncertainty? And all the changes we were talking about the businesses, etc. So if you can give kind of, some of the main points that you're thinking about now when you're looking at business continuity and the different services that you still need to provide.
Okay. Early on, I decided that the city will not close. The city will continue to maintain and provide the services that the residents expect. But doing that, obviously, we have to provide protections to our residents and to our staff. Now, as a result of that, I'm in the midst of finalizing our budget. I had obviously put together a budget. We start our process really in March. Frankly, discussions with council and generally wrap up in April. But the governor gave us 30 days extension for every community, and ours happened to be in April. Some communities in Connecticut are a little bit later, some are a little bit earlier. So we normally wrap up in the end of April. Now we're wrapping up the middle of May, end of May process. So our budget was developed pre-COVID-19. So we have presented went through most of that presentation. And now we are relooking at that before we go to final approval. What is the reality of what COVID-19 is doing to city finances? So we are recognizing that we will probably face some fiscal restraints in terms of what taxes we can collect. So as a result, I've been going through activities this week and last week with my finance director to see what savings we can obtain, what things that we have to utilize, recognize what we're lucky enough to have a fairly significant fund balance that we can use to perhaps smooth over shortfalls, but utilize that as little as possible. So our constraints are what would be expected, and I'm sure every other municipality across the country is looking at those as well. As an example, we projected to collect $130 million in taxes this year, and we have since revised that down to $126 million, what we would expect to collect. So that's an example of how we've, that delta of $4 million is what we basically are looking at how to deal with that.
Which could be, I'm guessing, a higher percentage in other communities that are more in, basing on tourism and basing on, because you did mention that you have some manufacturing facilities in the city that are probably, will open sooner than other cities.
That is, I'm sure that's the case. Well, and many of the manufacturing facilities have not actually closed. So they are still running and working. Now, I don't know what on their end, how their business environment looks, but they are still in operation. It's really our smaller businesses, the mom and pops, that are of major concern, and mom and pops because they're also residents of the city.
Mm-hmm. And one of the questions we got here is that will the drop, you said $4 million, will be shared across all all departments, or will specific departments be more affected?
We have pretty much shared it across the board, but there's no formula. I wasn't going to institute, say every department gets cut 5%, 8%, 10%, whatever. I mean, that's contrary to how I look at an organization. It needs to be, you need to look at prioritized and priorities and make sure that we make informed decisions on every cut that we do make.
And yeah, and another questions we're getting here is that, are you also expecting, and I know this is a day by day kind of situation, but expecting that possibly the next year after that will also have a drop? So, or do you think that the economy of the city and the situation and the budget of the city will come back to what it was before?
Well, the short answer to that is that we are planning for continued stress on our budget. Now we anticipate it not being as severe as this fiscal year 21, but we're certainly planning and massaging, using financial engineering to make sure that we are going to be able to address and be prepared for fiscal year 22 and what may or may not occur. Now, my fervent hope is that we go back to what our numbers looked like back in February. But the realistic component of my personality was probably not going to be there. So we are preparing for that by looking at, okay, what purchases can we schedule? What can we take advantage of right now in terms of financial instruments? Because there are some advantages that are occurring right now in many communities. I know are taking advantage of those. The short answer is that yes, we are anticipating that fiscal year 22 will also reflect, though we are understanding it's probably not going to be as bad as fiscal year 21.
But you are planning ahead and not assuming 2019 budget or even 2020.
That is correct.
So what do you think, and we have only a few minutes left, so we really want to hear from you, kind of some advice you have for city managers, and what do you think should be the top priority for the next few weeks when we're looking at reopening? Some states are maybe past their peak and are going to be dealing with different, social distancing is going to move to kind of more day-to-day and the new normal. What do you think are a few of the major things that city managers and city staff should be thinking about in the next few weeks?
I would say the biggest thing is to have a plan. Communicate the plan and follow the plan. We are now moving, I started staff on this last week to develop a reopening plan. And part of it was a strategic communication decision on my part to let both staff, counselors, and by extension the public that we are planning to move to reopen and that we will have a plan for development for issuance next week. That includes how do we, what phases we go through, what are the decision points that they'll tell us to move from phase to phase, what are the protocols that implement to protect staff and by extension protect the public and still be able to provide city services. So I would say, first of all, have a plan and very closely associated with it and virtually the same priority in my mind is communicate. You can communicate the plan, but communicate what your decisions are, communicate what's going on, utilize every outlet that's available to you, and always stay open to suggestions and recognize that you aren't the full expert on everything. There's somebody knows something that you can use, so pay attention and listen to what is going on around you.
And this is relating to the next question, I think, pretty perfectly, which is what are the checks and balances that you're taking into consideration to see what plan is effective and whether the plan that you came up with is effective?
That's a really good question. the checks and balances, one has to determine when you, and start off with criteria that, that has to be reached before you implement a component of a plan, phase, et cetera, whether it's monetary, whether it is associated with the epidemic. Now, that's a larger statement than the city, you know, affecting the population. But having a criteria that is measurable, that you can determine what you're going to do next, and then see if you meet that criteria before you move, and complete that criteria before you move to the next phase.
Tim, can you give an example just for one criteria, just to explain how you measure it?
Okay, one of the criteria is utilize. We won't implement full service or movement towards a phase until we see 14 days of hospitalization decreases in the county. And now we happen to have a hospital right here, so it is of some extent, a Meriden issue, because we do have the hospital right here, so that there is a connection to the city itself. We have been seeing that in our hospital, so that moves us to an initial criteria. Another one is have we implemented all the protocols, the physical protocols in place to make sure staff can maintain social distancing in their workspace. We are, just before I came in, I was talking to my facilities director, a former Navy Seabee, so he's very creative, and I always kid him about that, being an Army guy and him being a Navy guy. He's working on how do we develop partitions between our employees, how do we enhance our ventilation systems to make sure we ensure adequate flow of fresh air, which is another item. So there's quite a lot of little nuts and bolts that may go into that. But those are some examples of some of the specific things that we are determining what we need to do in order to move forward.
And so we just have a few more minutes. So anyone in the audience, please feel free to ask and send your questions. And one more question that we see here is asking whether the 14 days, you mentioned the criteria of the 14 days without a major hospitalization. Where are you in these 14 days? And is it communicated to the residents? Like the criteria that you shared, is it also communicated to the residents, or is it an internal measurement for the city?
Well, these numbers are reported regularly, both by myself, by the mayor, by the public health director, in terms of hospitalizations. Now, we haven't said, okay, day 114 counts on this particular day, and this is how we're counting, because it's still a little early in our process for that. But we're at least over a week into what we saw as our peak hospitalization with the city, with our city hospital.
And do you imagine that additional criteria that you're forming at the moment to make the different decisions about reopening, etc., will be communicated to the public as well?
Yes, when we're still on a draft plan now. The basic ideas of that will be communicated to the public. I mean, we won't be saying, okay, Joseph's desk on the second floor will get this particular partition, while Jen's desk on the next office over is going to, we won't be that specific, but it will be stated that there will be physical changes to the facility to protect you and the city staff. That will be communicated for sure.
And also to the public regarding reopening of possibly restaurants and other facilities that are closed at the moment.
And that is a decision on the governor's part. It's really not a decision on the city part. So we really don't have any say in that. We have to follow what the governor has determined in that regard.
And this is maybe a good segue for the last questions, and then we'll be wrapping up because we are over time. But you know, this is just I think so interesting to hear. You did say that, you know, the governor is making some of the decisions and not the city, but obviously the city, the residents are seeing the mayor and the council members as the closest level of governors that are seen. So have you seen maybe confusion between who is giving the orders and who is following them, or how is the city communicating, you know, different decisions that are actually not being made by the city?
Yes, there is confusion. There has been, and we try and convey and recognize that the state drives much of what's occurring in the city, and explain that every chance we get. But this has been a rapidly evolving event in the sense of, okay, well, now we have the medical advice has changed, so we need to do this. For example, masks. The requirement to wear masks, certain requirements to wear masks while outside was put out by the governor. Was not conveyed by the city, but yet we're the ones translating what the state governor has put out into action within the community. Hasn't always been perfect. I'd say we're probably at a 90% success rate, but there have been some failures. And those failures have to be communicated and accepted right away. As soon as you know that you're wrong, convey that information and convey what you know to be your best knowledge of what is correct.
Well, Tim, thank you so much for your time today and for the very actionable advices. And we'll make sure to share the video, the recording of this to anyone that asks, and you'll probably get a lot more questions after, you know, everything you shared will be listened to again. But thank you so much for sharing your knowledge today, and we really appreciate your partnership, and looking forward to hearing about more and more businesses opening and people staying safe in your city.
So am I, Noah. Thank you. And thank you everybody who was on here, and anything I can do to help my peers out there, I'm more than happy to provide that.
Thank you, everyone. Have a wonderful day and stay healthy.
Take care.